that a week, my darling, OK?
Okay.
Give that a push. Any concerns, we'll write to you. Lovely, well done.
You mind if I use my phone?
Stop ringing now.
All right, so I'll leave that prescription at reception for you.
OK, bye-bye.
Who's that?
Oh, for the kids.
The grandchildren, yeah?
That's the 3.5-year-old, that's the 1.5-year-old, yeah.
Oh, there you go.
Oh, hello?
Come and have a seat.
Chris, I'm sorry.
You're in demand.
It's my family name. Hello?
What sort of thoughts are these?
Like, I wish I wasn't pregnant. It's causing a lot of problems, so... And with us, and so that's why I just feel if I can try and
Yeah.
get better mentally.
Yeah, of course. Well, look, you've done the right thing by coming in. I always say to my patients that medications are only part of the solution here, and that really the actual cure is the support and the psychological therapies that we can often direct them towards. Mrs. James had expressed some worrying thoughts, and this did make me also quite concerned and want to get slightly more urgent help for her. So I think what I would like to do is get sort of more specialist advice before we potentially change anything. I think ultimately what we probably need to do is get you in touch with one of the community mental health team who can kind of guide you throughout the rest of the pregnancy. I think also we need to think about the period immediately after you deliver, making sure that there's enough support for you there, because that'll be a critical time as well, because obviously with twins it's going to be challenging. There is a special team that look after women who have mental health problems in pregnancy and then also in that immediate period after pregnancy as well. And I wonder whether you would benefit from them as well.
That's the Crystal team.
Yeah.
We're already part of it.
So you already are part of them?
We are part
okay.
of Crystal,
Brilliant.
Crystal,
okay.
yeah.
We've got drug and alcohol history, so it's...
Okay. And just to ask, with the drug and alcohol, is that something that's an ongoing issue during pregnancy, or is that something that...
Oh, no, I'm clean now.
Okay.
4 years in December.
Okay.
So, yeah.
All right. Okay. There's a lot of evidence linking drug and alcohol addiction with mental health problems. In the case of Mrs. James, in fairness, she had been clean for 4 years, and I'm not sure in her particular case there was a direct relationship between her past history and her current presentation with her anxieties. But it is always something that we bear in mind when we're targeting the type of support that they need. So I'll contact you before the weekend.
Okay.
It may be that one of the mental health team, I can give them your details if you're happy with that, and they can contact you.
Okay.
Is that all right?
Yeah.
Yeah?
Okay.
Perfect.
Thank you.
Okay.
Thank you.
Take care. Bye. Bye-bye.
Most people are trying to escape the heat.
Thank you.
Are you okay walking up the stairs?
I need the exercise.
Good. Well, don't we all?
Really like that smell. Fresh linen, isn't it?
My house is full of air fresheners.
Is it? Yeah, I do like that one.
There's one in the hallway when you walk in. There's one at the top of the stairs. There's one in the bedroom. There's one in the spare room. There's one in the bathroom. There's one in the living room. There's one in the kitchen.
Well, OK.
Right. How can I help?
Well, you gave me antidepressant pills,
Yeah?
but they don't work.
Oh, really? And is your mood not good?
No, it's not good. It's getting worse.
Really? And in terms of feeling down, feeling depressed?
I feel down, yeah, all the time.
Really? Yeah.
All the time.
Would you like some talking treatment?
No.
No? You want...
I sit in my house alone all day for the most part, and I go to bed at night. The same situation.
Do you feel lonely?
Yes.
You do, yeah. How depressed do you get at times?
I think at the bottom of the pit at times.
Just sit forward for me, Paul. Just take your temperature. How fed up would you feel?
Well, I don't see any future,
Yeah,
if you know what I mean.
I do, yeah. It's normal. So what do you do all day? How do you fill your time?
Doing nothing, usually.
We know that people who are lonely tend to become depressed, and the ordinary difficulties of life that we all experience become more of a burden for them. So we would call that a neurotic development.
I just wish I had an answer to it all, but I don't.
Well, I think there are people that we could get to help you to come in and visit you if you'd want, that would break the monotony. And there's a Slough Seniors group, which is very good. Age Concern will do it. And even the Fire Brigade have a loneliness service that is really very good.
Yes.
Yes. I'd like to see you with a fireman or two around. I'm sure that would cheer you up. But it's a very good service. I think that companionship is really important.
Yes.
We all need it. And then once you get a bit of it, it brings you out of yourself.
Yes.
And so that, I think, is the way ahead. And I think I'll organise that and get people to visit you. So I'd like to change your antidepressant medication.
Mm-hmm. Do these pills raise the spirits or...?
They do, raise the spirits, and they raise the chemical in your brain, serotonin, that is responsible for the feel-good factor.
Ah, good.
And sometimes in these situations, that's what runs low.
Yes.
Or it's consumed too fast by the nerve endings.
Yes.
So there's not enough of it there.
I see.
And what this does is it replaces that.
Yes.
And that's how it works. So you can give me a call anytime. Just let me know how you're doing. And I think those two things together will make a big difference. Good. Yeah.
Oh, dear.
Good. Because we're growing older in ever-increasing numbers, then unless we get really good at tackling loneliness, we will be paying the price for not doing so in all kinds of ways in society. And that makes loneliness a key risk factor. And I think it's one that we would ignore at our peril. Good.
Thank you very much.
Not at all. Nice to see you. Yeah, you take care. Do you want me to walk with you?
No.
You sure?
No,
Yep.
yeah.
Mm-hmm. Good.
Can we have a bit of that now? Yeah, that's fine. We don't do it when there's patients in because they may be suffering from asthmatic.
Amy Rosen. Good afternoon. Come and have a seat. Long time no see?
Yeah, how long has it been?
It's been probably a year, I think.
I went out a few days ago with my friend and we were just going in a park, but I felt like I had to sit down. It was just too much for me to cope with. And I was like, why do I feel like this? I should be, have energy. I just didn't feel like that. I feel like nowadays, I just feel like I always need to sit down.
Everything is a chore, tiredness, lethargy.
Yeah, and even like I'm a bit afraid in case I might faint or anything. Not all the time, just sometimes. I just don't know what that is about. Any idea? Or?
Tiredness can be due to 2 or 3 reasons in your situation. One of them is, of course, depression can make anybody tired. And the second thing is any other medical condition.
Amy lives with her mother. She's got Asperger's syndrome. Asperger's is a mild form of autistic disorder characterized by awkwardness in terms of social interaction and difficulties in non-verbal communication. Because of that, she is socially withdrawn and hence associated depression.
The third thing is any medical condition like diabetes or anemia, low hemoglobin, all these can cause that. Tiredness, lethargy.
I think it's a bit bad for both of us at the moment, also, because, to be honest, Amy's... Yeah, it'd be great if any physical reason was discounted, but the point is, the life she's living at the moment is bad for her in all sorts of ways, and it's not changing at all. She's so isolated. Her day,
desperate.
She very, very rarely sees anybody. It's not good.
The family dynamics of living with somebody who has Asperger's or depression can be very traumatic. They should receive help, support. They need to have their own sort of respite. Otherwise, we end up with a family full of depression. And that is not a good sign for the mental well-being of that child.
Amy missed 3 days of Prozac, and I kind of felt that she got more aggressive and verbally and, to be honest, a bit other way.
So please do make sure in the future not to miss, even if you miss not more than a day. Yeah. When did you last have any blood tests?
I think about 9 months, 6 months, 7 months ago. I'm really not sure. I'd be more than happy to have the blood test done. I just want to know, because it's just really frustrating and worrying knowing what's going on. You just don't know. And
Have you managed to have all these interventions and help and talking therapies and CBT and all that stuff?
I will be there next week.
That would be the right way forward. Okay?
Thank you very much.
All the best. Bye-bye. Take care.
Come on. Come on, be nice, nice, nice. Oh, yeah. Whose bright idea was it to make self-check-ins for doctor surgeries? They need shooting. They never work.
Actually, my doctor's surgery where I go, it works.
Hey, well, no.
How can I help?
Okay, so we think that Damien might have ADHD. There's a lot of stuff going on with Damien, his behavioural problems. We spoke to him last week and he said that he's got little miniature voices in his head that tells him to do bad things, and when he's doing the bad things, he also gets another voice in his head that tells him to stop doing the bad things. His behavioural problems have been ongoing for quite a few years. But to be honest, I think it might be time for a referral with Damien because I only know a certain amount. He has got a lot of anger issues.
And give me some examples of his behaviour.
Behavioural problems. He bullied a child in school for no reason whatsoever. When I asked him why he did it, he turned around and said, I don't know. And with his brother and sister, anyone touches his stuff, it's like World War III in his own little world. There's a lot of anger underlying in there.
ADHD sometimes gets used as a sort of catch-all for behavioural problems, which formally it isn't, because there are formal diagnostic criteria to be met. But it often presents with a behaviour problem.
You know, when he's playing, first to play on his own, he's the class clown at school. There's just very many things that are kind of pushing me towards that. And
Do you think things are getting worse?
yes.